Ladies and gentlemen, family and friends, scholars and dignitaries, welcome to another episode. Welcome to my world.
Hello, friends. So this is a very important discussion, but one that draws a lot of criticism. Yet, the truth needs to be said, and said time and again. If you believe that marijuana is a harmless drug or a soft drug with no adverse effects, then you, and a lot of people, are totally wrong. You have been the victims of myths and fallacies, many of which have been promoted by a cannabis industry that stands to make hundreds of millions of dollars off of the growth and sale of a drug. The truth is that research on the health and safety effects of marijuana strongly correlate with many mental, emotional, psychological, and physical problems. In addition, many crimes, accidents, job and school performance problems are associated with the use of marijuana. And of course, while not everyone that uses marijuana becomes drug dependent, the reality is that, as with alcohol and other drugs, marijuana use certainly can lead to profound, chronic, and progressive chemical dependency. It leads to addiction. So, have you ever seen anyone that has had a total nervous breakdown? Have you ever seen anyone that went into a true clinical depression? Have you ever seen anyone who had a psychotic break? Have you ever seen anyone that was suicidal? The incidence of those and other problems are far greater with marijuana users than in normal society. And while entire books have been written on the subject and hundreds of thousands have testified as to what marijuana has done to them, suffice it to say that I'm going to present just 5 reasons why you should not use marijuana. 5 very important and very powerful reasons. But to summarize it now, I am saying this: do not use marijuana. It is a powerful, mind-altering, mood-modifying, addictive substance with serious adverse effects and side effects. Its use can be very serious, dangerous, and have a profound impact upon the quality of life for hundreds of thousands of people and their families. And marijuana use is not recommended by any valid professional health organization. In fact, it is discouraged by every organization concerned with the health, safety, and welfare of its citizens. Do not use marijuana. First, the American Medical Association, the largest national association with some 190 medical societies, a foremost authority in promoting the science of medicine and the betterment of public health, recently presented their position on marijuana. The American Medical Association said that cannabis was a dangerous drug. It has an inherently high potential for abuse, that we should actively discourage use, and they recommended that people do not use marijuana. Furthermore, upon recognizing the dangers of marijuana use to everyone, the AMA also said, do not legalize marijuana. The AMA reviewed numerous studies about marijuana use. They also reviewed the testimonies of many recovering cannabis addicts before coming to their conclusion. And again, the AMA is not a governmental agency. They are a public organization dedicated to science and medicine. In effect, their testimony as a leading authority in health and medicine completely negates and refutes the myth of marijuana being a harmless drug and goes right to the very point of why people should not use it. Second, the American Psychiatric Association, the APA, a national organization dedicated to emotional and mental health, after a 12-year field study found that 8 psychiatric mental disorders were caused by cannabis use, including anxiety disorders, depression, bipolar disorder, schizophrenia, amotivational syndrome, disruptive cognitive functioning, neuropsychological decline, and psychotic disorders. The APA also identified 4 primary cannabis-induced physical disorders: lung damage, heart disease, cancer, and pregnancy complications. And in terms of comorbidity, the APA found that between 50% and 90% of cannabis-dependent persons are diagnosed with an affective disorder, suicidality, or an anxiety disorder, and cannabis use is associated with poor life satisfaction, increased mental health treatment and hospitalization, and higher rates of depression, anxiety disorders, suicide attempts, and conduct disorder. The APA also found that cannabis use is highly related to other secondary substance use disorders, as high as 74%, and is often quite commonly found with major depressive disorders and antisocial, obsessive-compulsive, and paranoid personality disorders. Again, the APA is not a governmental organization, and by definition, they found that cannabis is a dangerous drug, and this research has been confirmed by numerous studies by others, including through the National Institute of Drug Abuse, all of which clearly demonstrate not just correlation, but causation between marijuana use and mental and emotional disorders. Third, one of the greatest myths repeated about marijuana is that it is not a toxic drug and, as such, it is a safe drug. The truth is that numerous legitimate and scientific studies have proven otherwise, but one study in particular clearly demonstrates three dynamics of marijuana use: that it is harmful across a spectrum of criteria, that it is as harmful and toxic as most other drugs, and that it is harmful to both self and also to others. A major study in Great Britain, published in the prestigious international medical journal Lancet, compared 20 different drugs against 16 categories of harm, either as harm to self or harm to society. The study, Drug Harms in the UK, a multi-criteria decision analysis on behalf of the Independent Scientific Committee on Drugs, sought to demonstrate that the proper assessment of the harms caused by the misuse of drugs can inform policymakers in health, policing, and social care. For the study, an MCDA, or multi-criteria decision analysis, model was applied to a range of drugs in the UK. Cannabis was ranked 8th of the 20 drugs studied for drug harm to self and to society. Additionally, the study found that cannabis was associated with some 15 of the 16 criteria of harm studied. There were strong findings for cannabis related to economic costs to self and society, crime, drug-related impairment of mental functioning, drug-specific impairment of mental functioning, drug dependency, and drug-related damage. Cannabis was also found associated with family adversity, loss of relationships, injury, negative effects on the community, loss of tangibles like income, housing, jobs, educational achievements, criminal record, imprisonment, and so on, and drug-related mortality, including accidents, cancers, and so on. But an important secondary finding from the study is that cannabis was found to be harmful not just to self, but also, significantly so, to others. This finding directly contradicts marijuana folklore that cannabis use is a personal decision and does not interfere with the rights, health, or quality of life of others. Now, the study does acknowledge that several drugs were more harmful than cannabis, but it clearly demonstrated that cannabis is not a benign substance and is a substance that has negative results across the spectrum of criteria used for measuring harm, and that translates into a real reduction in the quality of life for self, for your family, and for society. Fourth, is the very high incidence of cannabis addiction, and dependency is the classic hallmark feature of drug use. Well, for those who say that marijuana is a soft drug and that you can't become addicted to it, science has proven beyond a doubt that that's wrong. Research by many experts across the world conclude that marijuana use can be highly addictive. In the assessment of cannabis use by the New York State Department of Health, they concluded that, quote, from 9 to 30% of users can become cannabis dependent. One independent study showed that it was 10%, and a study published in the Journal of the American Medical Association Psychiatry showed that the number of people with marijuana use disorder is over 30%. Let me repeat that. Up to 30% of cannabis users can become addicted. And the proof? In any given day, just in my state, over 12,000 cannabis-dependent individuals are in treatment programs who have a primary diagnosis of cannabis dependence, and tens of thousands more are in treatment programs who have a secondary diagnosis of cannabis dependence. This isn't simple use or even heavy use, it's cannabis dependence. And they are seeing the same thing all over the world. More than ever, people are admitting themselves into treatment programs because the incidence of cannabis dependence is growing. and now with marijuana products having THC content as high as 90% or higher, it makes the drug even more dangerous and addictive. Marijuana does not have the THC content of 1 to 3% as it had in the 60s. It now has an average of 30% THC, with edibles averaging 68% and some products as high as 90% depending upon the type. Users are going nuclear. And if you don't think that cannabis fits the classic definition of addiction, one treatment program demonstrated that 2/3 of cannabis-dependent patients reported withdrawal, and most claimed serious problems from the cannabis. And progression from first use to regular use of cannabis, another characteristic of the cycle of addiction, was found as rapid as tobacco progression and more rapid than that of alcohol, suggesting that the drug itself potently reinforces cannabis taking, producing both dependence and withdrawal. And as for how potent marijuana dependency really is, many dependent users state that it is, quote, impossible for them to quit. In fact, one study included people who use both alcohol, cocaine, and marijuana, and many stated that giving up the use of marijuana was more difficult than either giving up alcohol or cocaine. And fifth are the adverse effects, the serious side effects of marijuana use. Now, all drugs have side effects, unintended effects, many of which are serious and dangerous. In the world of pharmacology and psychopharmacology, they may be classified as adverse effects and serious adverse effects. One of the most poorly understood and poorly appreciated sets of findings about marijuana use is that it has both short and long-term negative effects, harms, from use, and when people commonly dismiss them as either non-existent or negligible, they are discounting the very basic dynamics of drugs, especially including marijuana. In Marijuana Medical Implications, the researchers listed over 65 effects of marijuana, including both short and long-term adverse physical effects and adverse neuropsychiatric effects. With marijuana itself, research has found that a full 50% of the population of users experiences one or more adverse effects from use, including grave and even catastrophic consequences. In one study by the National Household Survey on Drug Abuse, it was reported that among those using marijuana on 12 or more days during the past year, 58% of people had one problem that they related to their marijuana use, 41% had two problems, and 28% had at least three problems that they related to their marijuana use. Depending upon the potency and dosage, age of use, frequency of use, and setting of use, marijuana has often been found wrought with real and significant adverse side effects, such that no one can ever guarantee the safety of marijuana use. Virtually every public health organization has advised against the use of marijuana, including the U.S. Surgeon General, who in his report on alcohol, drugs, and health warned about the wide range of negative physical and mental effects of marijuana. And while we've already mentioned a number of side effects, I want to quickly summarize just 5 others. First, look at the neuropsychiatric findings, the effects on the brain, by Dr. Daniel Amen of the Amen Institute. He found that the effects of smoking marijuana typically causes decreased activity in the posterior temporal lobes bilaterally, and he pointed out that the damage can be mild or severe depending on how long a person used and how much use occurred. Using brain scans from a SPECT scanner, you can see that marijuana reduces and disrupts brain activity by reducing blood flow. The scan on the left is a normal brain with a largely smooth surface showing that blood flow to this brain is good. Compare this with the pits and disruptions seen in the other image, where there is poor or no blood flow in the brain. And Dr. Amen says that this can have a dramatic effect on behavior, depending on which area of the brain is affected, and often these behavioral changes will be blamed on psychological problems when, in fact, there is a genuine biological basis for them, a basis caused by substance abuse. By the way, the brain on the right is that of a 16-year-old male who had been using marijuana daily for only 2 years. Dr. Amen states that the decreased blood flow can lead to brain cell damage and even cell death, which is why so many users report faulty memory and poor memory and lack of motivation. It certainly disrupts the maturation of the brain, and it can even lead to an actual lowering of the intelligence quotient by up to 8 points, and it, again, can permanently alter the serotonin and norepinephrine levels of the brain, raising the risk of long-term and chronic depression and anxiety, which is also why we are seeing a dramatic increase in marijuana-related suicides. Second, we have the amotivational syndrome. One of the newest findings of side effects is the correlation of use with an amotivational syndrome, characterized by a marked decrease in personal drive, motivation, and ambition, with apathy, lethargy, shortened attention span, decreased concentration, and an overall impairment of judgment and memory of the chronic user. Here, users are often not able to set and achieve life goals, and sometimes even the simplest of responsibilities, such as reporting to work on time. Over a period of days, then weeks, then months, and even years, this becomes a pattern of avoidance of school, work, and normal day-to-day responsibilities. Third is marijuana use and crime and violence. Marijuana use does not reduce crime, nor is it crime neutral. To the contrary, numerous studies have now found that crime and violence begins after people begin to use cannabis, and that continued use of cannabis over the life of one study was the strongest predictor of violence, and use was associated with a 7-fold increase in aggression, violence, and violent crimes. In fact, an article in the New York Times stated that, quote, before recreational legalization began in 2014, advocates promised that it would reduce violent crime. But the first 4 states to legalize marijuana, Alaska, Colorado, Oregon, and Washington, have seen sharp increases in murders and aggravated assaults since 2014, with a clear link to cannabis in many cases. And we aren't talking about arrest and being sent to jail for simple possession. No, the majority of states have now decriminalized marijuana. We are talking about a causative factor where use is a causation of crime and violence. Fourth is domestic violence and child abuse. There is now a growing body of evidence suggesting that both intimate partner violence and child abuse, serious and often fatal public health problems, are connected with chronic marijuana use. One major study found that even after controlling for variables, including alcohol use, antisocial personality symptoms, relationship satisfaction, and all known risk factors, findings demonstrated that marijuana use was positively and significantly associated with psychological, physical, and sexual domestic violence. Another study found that 53% of their sample of men arrested for domestic violence had reported past year marijuana use. This isn't an insignificant percentage. And evidence is now accumulating that shows that marijuana use can lead to child abuse and neglect, a lack of supervision, a lack of parental responsibilities in providing for the welfare of children, family disruption, and a poor quality of life for the child. And a major study in Texas of children who died in child abuse situations found that marijuana use by the parent or caregiver was noted in 75% of the cases. And fifth is the relationship between marijuana use and suicide. Because of the neuropsychiatric effects of marijuana and the negative consequences it has long-term, marijuana has been found to be highly correlated with suicide, both with higher suicidal ideation, and that includes both actual attempts at suicide and suicide completion. In fact, a report from the Colorado Center for Health shows that suicide where marijuana is present has increased over 350% since 2004 in that state, with marijuana being the #1 substance now found in suicides of young people in Colorado who are 10 to 19 years old. So we know that cannabis use can cause addiction. It can cause a number of physical disorders, including lung damage, heart disease, cancer, pregnancy complications, and brain damage. We know that it can cause a number of mental health and emotional disorders, including schizophrenia, bipolar disorder, disruptive cognitive functioning, and affective disorders, including anxiety disorders and depression, as well as neuropsychiatric decline. We have also found that it's related to a number of other life issues, including poor social functioning, poor academic achievement, lower quality of life, family dysfunction, apathy, phobias, emotional ability, mood changes, yes, including anger and deep rage, insomnia, poor job performance, an increase in DUI accidents, increases in personal and property crime, general lethargy, depersonalization, isolation from family and friends, and so on. It is a powerful, mind-altering, mood-modifying, addictive drug, and for many users it causes mild to severe distress, and for many users it can have profound effects and lead to a lifetime of heartache and failure. A final word about marijuana. Denial is one of the preferred defense mechanisms in all chemical dependencies, and this is true for cannabis-dependent individuals as well. We often hear, quote, "I don't have a problem," or "people overreact to marijuana," or "I can control the use," or "it doesn't have any bad effects." This is denial, and usually others can see what they can't see for themselves. In this case, as in most, they need to seek professional help at a local treatment center. Recovery begins with that first step. Make that call. Hey, be safe, be well. Don't use marijuana. Don't use any drugs. A life is a terrible thing to waste. And may God bless.